Dr. Indrani Suresh ma'am to the dais, please. I now invite Dr. Varsha for the prayer song. Check.
Gananada, Gananada, Katida Vandalagada, Gananada, Gananada, Katida Vandal Agada, Palakalam, Unai Paninde, Padamalar Tandida Kudada, Gananada, Gananada, Katida Vandalagada, Unsuri Pota Todangiyadai, Oru Kurayindri Mudipavane, Unsuri Pota Todangiyadai, Oru Kurayindri Mudipavane, En Seyalavathu Edumillai, Ellam Nee Endru Veru Illai, Gananada, Gananada, Katida Vandalagada, Maanai Pola Kuravalli, Manadai Mayakkiya Muruganukku, Maanai Pola Kuravalli, Manadai Mayakkiya Muruganukku, Yaanai Uravil Udavi Seydal, Yaanum Azhaithal Varuvaya, Gananada, Gananada, Katida Vandalagada.
I now request our esteemed dignitaries to kindly proceed with the lighting ceremony. Now, we invite Dr. Lalita ma'am to kindly address the audience, please.
Though we are late. So dignitaries on the dais, respected faculties, dear delegates and friends. I am extremely happy to speak to you at the inaugural function of Fetal Echocon 2026, organized by the Department of Fetal Medicine at PSG IMSR. It was on this day, 8th February, many years back, the Fetal Care Center was started. And on this occasion, I would like to remember with gratitude the visionary and foundational role played by our Dean, Professor S. Ramalingam, because he was instrumental in launching the Fetal Care Center. From then on, we have consistently received tremendous support from our management, which has been instrumental in our growth, and with the addition of new facilities, manpower, promotion of academics and research. In this context, I would like to thank our managing trustee, Sri Gopalakrishnan, our general manager, Sri Jagannathan sir, our director, Dr. J.S. Bhuneshwaran sir, our principal, Dr. Subbarao sir, and our medical director, Dr. Karthikeyan sir, is not here, and medical superintendent, Dr. Barun sir. So I would like to thank everyone for their support. And it was our director, JSB sir, who actually mooted this concept of this conference. He motivated us to conceptualize and organize an event of this nature. So he and Subbarao sir have been supporting us through the organization of this conference, and I'm very grateful for all your support, sir. Regarding Professor Suresh sir, he has been a pillar of support to us from the beginning, from the days of our inception till date. He is our visiting professor, and he's constantly supported us through, in the sense that initially when we started, it was a one-man department. From 2018 to 2020, he used to visit us monthly despite his busy, hectic schedule, and it was only COVID that could stop him from traveling. And he's been mentoring and supporting us in the development of fetal interventions at our center, like the initial few intrauterine transfusions, and then we have done a laser ablation, we've done radio frequency ablation, microwave ablation, all thanks to Professor Suresh sir. And despite his very busy schedule and hectic academic programs in India and abroad, he has given sufficient time to deliberate, plan, and assist our institution and especially our unit to take baby steps, grow, and establish as a high-quality unit. The Fetal Echocon is being organized under his mentorship and guidance. We are proud to honor him today with a Lifetime Achievement Award. So he was instrumental in connecting us to the ISWOG president, Professor Reem Abu Rustam, and she has actually given us a message which would be played at the end of this ceremony. And as coming to Dr. Indrani Suresh ma'am, she's a great teacher, as all of us know, and personally I consider her as one of my mentors. So every time I go meet her in Chennai or anywhere, she'll immediately ask me, what new have you done this year? And it's always, I feel very tense going and meeting her, because she'll always put me in that thing, but she would eagerly encourage me to take up new things every time, and sincerely I've always taken up those ideas, and I've worked towards implementing them in day-to-day practice. And we are happy to honor her today with the Pioneer in Fetal Echocardiography Award, which is befitting her phenomenal role in nurturing fetal echocardiography as a specialty in alignment with the theme of this conference. My parent department, the Obstetrics and Gynecology Department, led by Dr. Lata Maheshwari, they have been a constant source of support and motivation. I would say they give me a lot of love and affection. It's like I don't feel I'm away from the unit at all. Currently, we work closely together on delivering exemplary care to our antenatal women and their babies. On this occasion, I would like to thank the ONG team and expect to receive the same support in the years to come. Fetal echocardiography has been an area of focus where we have made substantial progress, and we've even had a PG look up our cases and present a thesis. Coimbatore as such, if you see, it's a regional hub. You've seen all experts from Coimbatore, you've seen Vijay Kumar sir, you've seen all our pediatric cardiologists. It is a hub, and where all these congenital heart diseases are identified, treated, they are operated, and they are given a good quality of life. So we are proud to say that we have also contributed to this in our own way. So this year, ISWOG has taken up this as their initiative. Every Little Heart Matters program is a flagship program of the ISWOG, about which Professor Rustam has delivered a talk. Under this context, we decided to make this the topic of discussion at our conference this year. This is the first annual conference of this magnitude that we are conducting at PSG under our department, and we hopefully propose to continue this as an annual event every year. We request the wholehearted participation from all of you. Year on year, come back to us with your friends and attend all our CMEs. I would like to personally thank our alumnus, Dr. Shanti Narasimhan. She is across the globe 24 hours apart, 12 hours apart, but still 2 days continuously she's woken up in the night and she's given her time. She's a pediatric cardiologist at the University of Minnesota. She is our visiting professor, and when she was here, she's taken time to teach our fellows and see our patients. Thanks a lot to Dr. Shanti. And I would also like to thank Professor Reem Abu Rustam. She's president of ISWOG. She agreed readily when we spoke to her to honor us with her talk. She's given a talk on overview of every ELHM program, Every Little Heart Matters program of the ISWOG, and she was very keen on delivering it live via Zoom, but due to her commitments, she is attending the SMFM meeting in Las Vegas, so she is traveling. So she sent us a recorded version which would be played here. An event of this nature was made possible only with the immense contributions of our team. So I would like to thank each and every member of our team. From conceptualization to execution, the faculty and the fellows have taken it upon themselves to meticulously plan every minute detail. Okay, so they have worked day and night towards completion of all the tasks with a lot of heart and dedication amidst the busy clinical work in our department. I sincerely thank all the members of our department. The support from the marketing team also, and all the support teams has been excellent, and they've been great contributors in making this event a success. I would also like to thank the industry who supported us with their contributions. And without taking much more time, I would like to call upon our director, Dr. J.S. Bhuvneshwaran, to give his address.
Good afternoon to one and all here. Respected Dr. Suresh and Dr. Indrani Madam. We are being honored for honoring you. That is how I look at it. Because when I was a postgraduate in cardiology, I'm talking about 1991, 92, 93. I think many of you were not born. And we used to see articles being published by Dr. Indrani Suresh. Especially she was, in fact, I started doing the spine up, spine down, all the views of the echocardiogram, fetal echocardiogram. And so you can now realize and imagine the years and decades of service this great couple have put. And PSG was fortunate to train their son. I fondly remember the picture on the graduation day which I took in the front of the auditorium, me and Dr. Suresh with Sudarshan. So with such legacy, they have been supporting our program in PSG since I came back in 2019. This department is very, very dedicated department, and I'm so fond of Dr. Lalita primarily because she's such an inspiration for me. She's a karma yogi. I always call her a karma yogi. In a karma yoga says that कर्मण्ये वादकार्यस्य मापलेषु कदाचन मा कर्म पलहे दुर्बुः मादे संकोस्व कर्मणि. Do your duty. Whether somebody appreciates you, whether somebody knows that what you are doing is there, don't worry about anything. You just continue doing your duty, and rest will happen. In fact, people can ask, how can I do something without expectation? But actually it should be interpreted in a different way. You do your duty and accept whatever comes as a prasadam. Prasadam means, something you accept, whatever comes. Appreciation comes, accept. If somebody criticizes you, accept. It's as simple as it. So in that way, my inspiration for Karma Yoga is Lalita. That is how I look at her. And I am so happy that she has been a loner for many years. Somehow slowly now we have got a family for her in the department. Now she is ably supported by 3 or 4 of them now in a wonderful way. And I'm so happy that I've been telling her to do this for the last couple of years, in fact. So some or other reason it did not materialize. And you said that this is the day we started the department? Oh, that's wonderful. That means it's a sort of that needs a separate applause. How many years now? 8 years. So 8th of February, 8 years ceremony, and with honoring of great legends in the field. I'm so happy that Pradeep, Vijay, all of them have joined. I could see my dear friend Deva. Deva is here. Again, such a great support from the department, because I always say fetal echo is like a tug of war. One side radiologists will pull, and the other side the obstetricians will pull. But Deva is such a wonderful guy that he never pulled. He always supported. So he was that need a lot of courage. I know people who have been struggling between radiology, OG, they know the institutions. But in that way, thanks to both Deva and they have never come for any dispute. They have always come for solutions. There is no problem. So that way, we are blessed. I'm so happy to see a very cute fetal echocardiographic learners here, and I am very happy to be a part of this, and I wish you all the very best. Learn well and make sure that, in fact, when I saw Vijay's presentation, I went back to because cardiology it's a fascinating field, and that way 1 or 2 things which I suggest, the Lalita, so you should have some for your fellows who are being trained, they should have some exposure to pathology specimens. They have. I'm talking about pathology of the heart. And make sure that Umaji, I saw Uma, you show them some the cardiac specimens, and you can post them with the cardiology department also. In that way, this will make things, because they will have, even if they see the heart in a larger size, it's easier for them to understand it in a smaller size. So Minoti is sitting right in front. So Minoti, so make sure that it's being done. With these few words, I wish the function all success, and we are really eagerly awaiting to honor the two legends sitting in between us.
Thank you, sir. May I now invite Dr. Subbarao, sir, to value his valuable words with us.
Distinguished guests, respected faculty, esteemed delegates, dear colleagues, ladies and gentlemen, and the heroes of today's function. I'm very happy to be here as part of the Echocon 2026, and this conference reflects the progress that are being made in fetal echocardiography. A few months back, I was invited to a pediatric surgery conference. I thought pediatric surgery is a subspecialization, and in that conference they only spoke about pediatric urology. I was taken aback. Again, now we are going deeper and deeper into things, and it's very interesting. And we started this, I know Dr. Lalita started the fetal medicine fellowship program, and one of the feedbacks we were getting was they needed more training on the basics of fetal medicine before they could do that, because I could empathize with them, because When I joined my MD pathology, I was zero to begin with, because all that you remember in UG slides, UG is seeing the slides from outside, not from inside. So you have no clue about it. So when you do a radiology program, therefore it becomes challenging to understand what it is. Then we had a discussion, and we took the advice of Dr. Suresh, and he gave us wonderful ideas as to how to kickstart, what should be the initial learning phases and all that. So on that background, it is so very happy that we are privileged to confer the Lifetime Achievement Award to Dr. Professor Suresh Seshadri today. Sir, your vision, academic leadership and commitment have laid a strong foundations for not just fetal medicine and also for fetal echocardiography, along with your better half, Madam Dr. Indrani Suresh. Then one other activity I thought I will share is also in diagnostic laboratories, our armamentarium grows when we have very smart clinicians. We were having basic tests, and then remember in 2000 when suddenly Dr. Chandy came from CMC Vellore, and he said, you don't have a frozen section, what kind of pathology department? So we woke up and we all started frozen section. He said, you must have it because I can't operate Hirschsprungs without it. So like that, as we were growing, this evolution of fetal medicine saw the evolution of perinatal pathology, and very proud that Uma is taking care of that. And soon we are going to start a fellowship program in perinatal pathology as well, so that we go more and more into it. So, and I would like to really appreciate and congratulate the exemplary work done by Dr. Lalita and her team, and I wish this conference all the very best. Thank you.
Thank you so much, sir. It is now time to honor excellence and dedication as we begin the award session. Moving on to our first awardee, Dr. Suresh Seshadri.
Dr. Suresh Seshadri is a fetal medicine expert and founder-director of Mediscan System in Chennai, renowned for advancing prenatal diagnosis and therapy in India. He was instrumental in introducing, nurturing, and advancing high-quality prenatal diagnosis at a time when fetal medicine was still in its infancy in India. He was conferred FRCOG by the Royal College of Obstetricians and Gynecologists in 2010 and Doctor of Science by Dr. MGR University. He was nominated as ISUOG Ambassador to India in 2017 and currently holds the post of Trustee and Honorary Treasurer of ISUOG. He established Mediscan in 1982 as India's first structured ultrasound training and research center, training over 5,500 doctors globally. His key achievements include setting up Tamil Nadu's inaugural Prenatal Diagnosis and Fetal Therapy Center and the Fetal Care Research Foundation in 1993. He pioneered Down syndrome screening programs in India, developing reporting software via meteorological solutions, and launched the Birth Defects Registry of India across 450 hospitals in India. Driven by social responsibility, Dr. Seshadri has provided free ultrasound services since 1995 to underprivileged patients, including those from government hospitals in Chennai. He led NRHM training for obstetric ultrasound in 126 primary health centers and supports over 270 families affected by mucopolysaccharidosis. As Honorary Secretary and EO of Voluntary Health Services Multi-Speciality Hospital in Chennai, he focuses on affordable healthcare. He has received numerous honors, including the Tamil Nadu Scientist Award 2004, Lifetime Achievement Awards from Chengalpattu Medical College alumni, Tamil Nadu Dr. MGR University, FICCI with Tamil Nadu Government 2014, and Indian Medical Association Puducherry 2015. We are proud and happy to present him this Lifetime Achievement Award, which celebrates his phenomenal work of more than 4 decades of transforming fetal medicine, standardization of ultrasound practice, and commitment to accessible care. His work continues to inspire excellence, compassion, and innovation in prenatal care. May I now invite our esteemed awardee, Dr. Suresh Sir, to receive his Lifetime Achievement Award, please.
Dr. Indrani Suresh. Dr. Indrani Suresh did her MD in pediatrics from ICH, Chennai. She is the HOD in fetal medicine and cardiac unit in Mediscan, Chennai. She trained under Professor Raghavan Subramanian in pediatric echocardiography for congenital heart disease at Sri Chitra Tirunal Institute of Medical Sciences at Thiruvananthapuram. She published the Mediscan Manual of Fetal Echocardiography with Atlas of Common Cardiac Anomalies in 2021. She is widely respected as a pioneer in fetal echocardiography in India, known for her meticulous attention to detail and uncompromising clinical standards. She has set benchmarks in accurate prenatal diagnosis and ethical, compassionate counseling. Beyond her clinical achievements, Dr. Indrani Suresh is an exceptional teacher and mentor. Generations of fetal medicine specialists across India and beyond have benefited from her guidance, wisdom, and passion for teaching. Through her work at Mediscan, she has combined education and patient-centered care, leaving an enduring impact on maternal fetal medicine and improving outcomes for countless pregnancies. With an unwavering commitment to clinical excellence, academic rigor, and ethical practice, ma'am has played a pivotal role in establishing detailed fetal echocardiography as an integral component of prenatal care. Her work has significantly improved early detection of congenital anomalies, enabling timely counseling, planning, and improved neonatal outcomes. This award recognizes her dedication to training, research, and knowledge dissemination has left an enduring legacy in the field of fetal echocardiography. Now we invite Dr. Indrani ma'am. With great honor, I invite Dr. Indrani ma'am to the dais to receive award in Pioneer Fetal Echocardiography. We now invite Dr. Suresh sir to speak on this momentous occasion.
Good morning, dignitaries on the dais and my colleagues and friends who are here today. It's truly a humbling moment to receive this Lifetime Achievement Award from an institution which I deeply respect and extremely proud of being associated with it for several years. This institution has not only given me the opportunity to be in an environment where a person like Lalita is enthusiastic about pushing forward the concept of fetal medicine and ensuring a department is established, but also because this institution has given my family education, because both my sons are from this institution, one from the medical college, the other from the tech institute. So I do owe a lot to this institution, and one of the reasons why I really wanted to come here was because I wanted to give something back, and that's why this whole association, even when Sudarshan was here during the second year, I was telling him, is there anything I can do for the institution? So ultimately it happened, and there's been a matter of joy and pleasure to be associated. But when you receive a lifetime award like this, you have to think through your journey, and during this journey of so many years, it cannot happen just because I did something. It's because you are brought to this situation by several factors, and one of the most important thing is there should be somebody who is there behind you to ensure that you can achieve what you want. And that in our ecosystem, obviously there's one person who constantly says, okay, you can achieve what you want, and gives you the freedom to do it, is none other Dr. Indrani. I remember the long days where I used to be at work, many weekends traveling continuously across the length and breadth of the country because of the passion for teaching, and lots of sacrifices made. But all that not only has enhanced my knowledge, but also the connect with the rest of the world, understood what was actually required on the ground, and we were able to fine-tune what we could do. And that, I think, was a anchoring point. Secondly, when you try to do something, anything that you do needs to be validated. And that validation, when it comes from your own colleagues, that is validation. There's no higher validation that can be considered as, what should I say, sacred, as the one given by your own colleagues. So when you start training people and they go and do well, they achieve well, there is a sense of feeling that you have made some contribution to change in the ecosystem. So I recall back the day when I wanted to learn ultrasound, and I was searching where can I go and learn, and at that time the word ultrasound was unknown in this part of the country. So I identified one person, Indrani and myself went, and the way we were received and the initial trepidation of should that person said, I don't know, I have not trained anybody till now, so I'm not sure whether I should be taking you. So we made a deal. We said, allow me to stay here for 1 week. If you feel we are trainable, we'll come back for more longer period of training. And this was Dr. Hemant Shah from Mumbai. At the end of 1 week, he said, I think we can train you, but only one condition, that you must do ultrasound full time and not divert your attention to any other branch of medicine. This was a condition that was given to me in 1982. And that was a defining moment, because it took me 2 days to decide. Being passionate about surgery, it took me 2 days to decide, but I decided and then jumped in. And I told him genuinely, I live up to my word. I will definitely give up everything and do only ultrasound. So some moments in your life are very defining moments. And that one decision that was made at that time, having made that decision, I had no other option to try to do my best to what was to be done. The second decision which I made was that irrespective of whoever may approach, this modality must be made available to the last person on the road. It should not be denied to anybody, because at that time I found people were traveling from other states just to have an ultrasound. They spend more money on the transport than the cost of that ultrasound. And that was a very important moment. And that's that decision that it should be made available for everyone helped thousands of patients, especially in the government sector, who not only benefited by it, but the medical practice itself was much better, because today we have moved into from an era of obstetric ultrasound to ultrasonographic obstetrics. So today there is no obstetrics without ultrasound, but at that time it was very different. So everything happened because there was a need, and this need, more and more people started having faith in the system. The technology improved, our skills improved, and overall deliverance of care actually changed. I think in this century, if there's one modality which has actually transformed practice in a very significant way, it is the field of ultrasound. So what I should say is, probably I was in the right place at the right time, and that's what brought us all here. We have to thank the Almighty for giving me this some thought, inspiration that we should do this, and the opportunity to move ahead, because every place where you go, there is a deep amount of love, affection and respect which is given, which makes you feel even more responsible that you have to do, you have to keep up the expectation of the people. So thank you very much again, once again, and I thank everyone who have been part of my life, who has given me, and this is a sort of a very cherished moment, because also I will say this is the biggest size award I have ever received. So and it will proudly adorn my room, my system, where today I can proudly say that I've been fortunate to be part of the PSG group, and always there for anything that I can do, little contribute back to this institution. Thank you very much.
Thank you so much, sir. We now invite Dr. Indrani ma'am to grace us with her words of insight.
Good morning, one and all. It is like I can give academic lectures, but suddenly you asked me to speak on this. I can just say first, I have to congratulate Dr. Lalita for organizing this event so beautifully, and she has selected the speakers, and she has also made sure that state of the art is being presented. Like yesterday, I heard that Dr. Karmegraj, she did a very good presentation, because I will be always challenging with my son. He will say that you are not updating. He'll say, then that means you are not reading ma these days, he'll say. She always keeps one yardstick for me. And because whole yesterday's lectures, he was telling what happened and how it went on. And today I am able to see, trying to bring in the virtual reality and how we can go next step by using, of course it's a little far-fetched, doing a 3D in a fetus. It's not as simple as in the postnatal, where you put your probe over the chest and you get, but still that idea that we have to be one step ahead, and you have to be abreast with what is happening. And Lalita is a very, very quiet person who does everything very neatly and gracefully. My congratulations to her department and her teammates for this excellent achievement of this 8 years. She has successfully taken the department, and all my good wishes to scale up more every year, do some CME, at least one day program like. And regarding this, I think probably this is the first time I'm receiving an award for doing something in fetal echocardiography, but it's been a passion for me. Because I did my pediatrics in Children's Hospital. That time we did not have any subspecialties, but as a MD postgraduate, we will have any unit, we have to attend a special clinic. So I have done liver clinics, I have done nutrition clinics, and I have done cardiac clinics. So all of them impressed me very much, because in the first year in the nutrition clinic, I learned how much, because those days the undernutrition was one of those major issues. And it is not like you have a diagnosis syndrome, you have no treatment for that. Whereas If you find nutritional problem, you can set it right and make sure the babies grow well. You have to feed them when they are growing, because baby's name, his name is today. Now I say the fetus name is today. So we have to give our best to the baby. And from then on, cardiac clinic in, I did between 79, 80, 81, I did my pediatrics program. That time there was no echocardiography. We used to have only X-ray and then ECG. And then Perloff pediatric cardiology book I always used to have, because when we run the clinic along with the assistant professor, we need to know something more than the general book. And there will be some images of echoes of the postnatal babies. And from then on, when we started doing ultrasound, then I realized we have to examine the fetus like how we examine a newborn, from head to toe, systematic examination in 22 weeks of gestation. That's the time we started in 83, 84. And my first presentation I did in 86 in Mumbai in an adult cardiology conference, 8 cases of fetal cardiac anomalies, and I was feeling thrilled. But then one gentleman came in between the break. He asked me, very good, what are all the cases that you missed? Then that made my antenna go up. But we had a very good, we used to attach along with the report that one postcard where they have to tell date of delivery, how the mode of delivery, how the baby is doing. So when I started looking all those cards, I realized many cardiac anomalies were missed. I said, okay, so this is the area we need to strengthen more. And we started looking at the 4 chambers in 84, 85, 86, and then added on the outflow tract imaging. Because each time when I add something, it is a challenge. I have to make sure that I do it in all my patients. It's not exempt. And that gave me more inspiration. We got our Doppler machine. 86, we got our black and white Doppler. And that's the time I realized I went to Seshadri to get trained. And Professor Raghavan Subramaniam is one of those finest cardiology person, a very good clinician. Because when PGs, DM cardiology PGs are struggling to get the Doppler waveforms. Because black and white, you can't see the jet like how you are seeing now. You have a stenosis, you see a poststenotic jet, and you can put the sample volume over there. But then he will say, he will auscultate and he'll say, you put the probe here and then you will see the jet. So that is the thing I got really very, very impressed how far we can take. But the basis is your clinical medicine. So I made sure I followed up all these babies diagnosed and missed postnatally, or if they had gone in for termination, those diagnosed anomalies, I made them bring the fetuses so that we could fine-tune our, and there we built, and I should say my Manasika gurus are Professor Robert Anderson, because his book I bought, and then I started looking at how, according to the echocardiography cuts, you can do morphology cuts, because mostly I bought the books and I started practicing. So I could bring it out, and the best thing is my experiments I did all with my students. I thank one and all the students. Whatever I tried, I made sure that everyone practiced, they understood, they could bring it out. It is not enough I can do it. I should make sure that it can be replicated by everybody. And for all that, I feel very happy for having come this far, because the technology has made our life so good and happy. I'm each changes that is happening, and I have to thank first the support given by my parents, my sisters, and my mother-in-law, who was a great support to my family, because raising 2 children and doing professional work with a very highly demanding, like Narendra Modi like husband. The current Narendra Modi is the way he used to be right from the beginning. Morning one place, afternoon one place, evening one place. But I had also immense support from Dr. Suresh, whom we have a kind of friendly relationship. It is not that, and we, whenever I go down, he says, it is not that simply don't keep lying and telling leg is aching, this is aching, that you're all right, you come on, you get up and come, he'll say. I need sometimes that. Sometimes I used to be thinking, I become very tired and exhausted. I can't work. You say, you are looking very good. You can come. He'll say. Thank you very much, Dr. Suresh, for all that stimulation that he has been always. And we form a kind of mutual admiration society. We do fight a lot, but we keep appreciating each other's work. And I thank Almighty to put me, because I don't know what I have done in my previous Janma, because I grew up from a very, very humble family where hand-to-mouth existence, like coming to medicine itself is not something known. Because of the Government of India scholarship I could do, and from that we have been able to come to this. I thank Almighty, and I wish all good success for Lalita for all her programs. Thank you very much.
Thank you so much, ma'am. We are honored to hear from Dr. Reem Abu Rustam, President of ICOG, to share her words with us about the overview of Every Little Heart Matters program of ISUOG.
Good morning, everyone. My name is Reem Abu Rustam, and I'm truly honored to be here at the opening of Fetal Echocon 2026. I would like to sincerely thank Professor Seshadri and Lalita for this unique opportunity for me to be able to address you. I wish I were with you for these 2 days. It seems that you have an outstanding course planned. I wish to share with you a new global initiative that the International Society of Ultrasound and Obstetrics and Gynecology has launched in September of 2025. And I would like to invite you to engage with us in the various activities that we have. Your course, Fetal Echocon 2026, truly aligns with the mission of ISWAG and the vision of Every Little Heart Matter campaign, and I'm going to share a few slides and some information with you. Now, as you all know, it's time to take action for the heart, and nobody is more equipped than all of you, because you already are all gathered here today planning this outstanding course. But we know that what our mission at ISWAG is to make sure that every woman has access to ultrasound facilities and competent care providers, that we arrive at effective diagnoses and improve clinical outcomes, because every little heart matters. We all know that congenital heart defects are the most common type of defect, affecting nearly 1 in 100 live births, and nearly half of them will require medical intervention within the first year of life. 30% are associated with other congenital anomalies, and they contribute to more than 50% of congenital anomaly-related deaths of childhood. Despite all the achievements that we have arrived at, we know that our prenatal detection rates are still suboptimal, especially in low-resource settings, and it has been shown that training improves detection, and of course, we know that detection does improve outcome. This has not been addressed, and this is why we have felt as ISWAG that we're uniquely positioned to take on this initiative. We, as the leading authority in prenatal ultrasound and fetal diagnosis, feel that we can really facilitate raising awareness around the globe and playing a significant role in educating healthcare providers. We have over 17,800 members, and we are very proud of our growing numbers in India. We are proud of having Professor Seshadri and Professor Mala Sebal on our board of trustees. We have have ambassadors from India. You all at PSG Hospital, I am aware, have engaged with basic training and have the trainee membership for your trainees. And so we are very proud to have you with us. ISWOG is present in 165 countries in 18 regions. We have over 400 volunteers and 41 ambassadors. And so we feel with everybody's combined passion, we truly can improve things and shine the light on the patient voice as well. Together, we believe that we can make a difference. We can improve access to quality sonographic screening. We can raise awareness among health professionals. We can raise awareness among parents and patient groups and try to close the gap in knowledge and access. Our goal from Every Little Heart Matters is to demystify cardiac imaging. Everybody is scared to image the heart, especially in underserved regions. And we want to empower sonologists, even if you don't arrive at the final diagnosis, to recognize that the heart is abnormal. And so at the heart of what we plan to do is to promote quality education, equity in detection, maximize detection, and really try to have a positive impact. And to that end, first I would like to invite you to our webpage, Every Little Heart Matters webpage. This is the QR code. This is a webpage that is undergoing constant updating with various educational material. Right now, we do have a pocket guide as you screen and as you start to screen using the 4-chamber view and the 3-vessel trachea view. We have posters that you can print for your units. We have an outstanding cardiac handbook that Professor Simon Marr has dedicated to this campaign. We have a lot of content that is being collated and increased from VISWOG and from our guidelines. We have a planned course in Seville in May, various content that the Education Committee and all of our subcommittees are putting together, and Professor Seshadri is really helping us put together an app to house all the content. We have just launched. February is Congenital Heart Awareness Month, and February 14, Valentine's Day, is Congenital Heart Awareness Day. So our Next Gen committee has put together Education Heart Bites. So watch out on our social media because these are being released on a specific timeline. We also just launched this week the VISWOG Case Challenge, where there will be a case unknown posted that you can test your knowledge in, and then it will follow with educational material. The app is coming very soon. We have a lot of material that has been shared from our journal. You will find this on the Every Little Heart Matters webpage. We had a virtual issue that our cardiac editors put together back in September, and there is a new issue that will be available in June. There are many podcasts that are available highlighting the patient voice, information from our editors, and more to come. So I hope you can join me. I know you already are ahead of the world with your dedication to education, high quality education, and together we can make an impact, because imaging should be a right, not a privilege. We remain available to all of you. ISWOG is well represented at your conference. Please feel free to reach out to me or any member of our society, and we are delighted to have you. And I thank you again for the opportunity for me to be with you today. Have a fantastic Congress.
With this, the inauguration of Day 2 of Fetal Echocon 2026 stands concluded, and we now resume the scientific sessions. It is our privilege to have this session chaired by two distinguished leaders in radiology whose expertise span fetal imaging, cardiac imaging, and advanced diagnostic modalities, Dr. Devanand and Dr. Geetanjali.